A new facial feature, and so we were thinking how we can do this segment interesting for you. So Roz, Tracy, and I decided,
real interesting.
Yeah, volunteer to see how this computer program really works. Dr. Steve Dayan is a facial plastic surgeon here in Chicago, and he joins us this morning with more about this program. Nice to have you here.
Good to be back, and I had a lot of fun with this one. This was a lot of fun.
We had little ideas and maybe little things that we wanted to do, and so we want to see what it looks like. So this is a new program that you can do with all your patients.
Well, it's not necessarily new. We've had it for quite a while.
Okay.
But it's upgraded such that I can take your picture and I can morph it in such a way to make you look like what you would look like after plastic surgery.
Okay.
So it's quite interesting, and it's a lot of fun.
Well, let's take a look. What you did was you came into our studio one morning and took pictures of us, of the way that we look like, and then we kind of told you the little things that we wanted to change. Tell us about my face over here. I wanted a different nose, right? I want a cute little nose.
So we adjusted your nose a little bit, and you can see the benefits of adjusting your nose a little bit. Now, your nose is very nice, but we can make some nice little changes, give you some improvement.
Okay, that's what we're looking at. The before picture is on the left, and the after picture is on the right that you're looking at.
Correct.
You can see Dr. Dayan took down my nose, right?
Or yes, I narrowed the tip a little bit.
Okay, you narrowed the tip. And then what did you do to the cheeks?
Well, I also narrowed your cheeks a little bit. I just removed a little bit of fat from the cheeks.
Thanks. you did the cheeks, and what else did you do? You also did something with my chin. Oh, you can see with this side profile
This one you can really see. And here, I just brought your chin out a little bit, and it gives a little bit more balance to the face. And you can see the improvement also with your nose. I narrowed your nose a little bit and brought down the convexity a little bit. So it's a straighter dorsum, straighter bridge.
Wow. Yeah, it does look good, huh? Doesn't it?
You're saving your money now.
Wait, I want to quickly tell you how much it would be, some of the procedures that Dr. Dayan was talking about. Now, there's quite a range, $350 to $1,200 for Botox around the eyes and cheeks.
Well, that's right, because it depends how much we use. And in this situation, I use Botox around the eyes and the cheeks, and I can also put it around the mouth and the forehead. So if you're just doing a little bit, it may range in the $300 price, and if you're doing a lot more, it may range in the $1,200 price. But it also matters where you go and what region you're in. Okay,
and next we're going to talk about Roz. Yes, Roz. What do we do with Roz? Let's see the... this Roz live, and then this Roz before, is it also on the left?
Yes, Roz before is on the left, and then Roz afterward on the right. And with Roz, we did a laser resurfacing procedure to smooth out some of the blemishes. Not that she has that many, but just make it a little bit better. And we smoothed out some of the wrinkles with a little mini lift. And we also did some work on the nose, too, and a little bit of Botox and Restylane to fill in some of the wrinkles.
What did you do to my nose?
Well, you can see we narrowed the nose a little bit, and we brought down the convexity, brought down the bridge a little bit. And the neck, you can look at the neck, and you can see how I brought that up a little bit also.
What's a mini facelift?
A mini lift is when we do a little bit less invasive of a procedure. We make tiny incisions on the side, and we tighten the skin, the muscle actually underneath the skin just a little bit.
And how much was that?
That's kind of expensive. It ranges from $4,500 to $15,000, really?
Well, yes, because that's a surgical procedure.
Wow, okay.
That's a surgical.
Okay, and finally we have Tracy, and we have, I think we're taking a profile shot of Tracy before, again, is on the left.
I would like to look like Reese Witherspoon.
Well, Tracy,
what did we do with Tracy?
We did a little bit of work on her nose, not too much. We also did a laser treatment, and we did a Botox treatment. We put a little bit of Restylane into some of her wrinkles, and we tightened the skin a little bit. Now, a lot of these things can be done in the office with no downtime. Yeah, that took a little extra work to get Tracy to look that good. But
it's obviously the after is the one on the right.
And that is courtesy of our executive producer, I'm sure.
You had no idea she was Irene Ryan, did you? Here's a surprise.
Listen, what's the difference between Restylane and Botox? Because a lot of people ask about that.
Yes, it's a great question. Restylane fills in wrinkles, whereas Botox is used to reduce wrinkles, reduce the animation that causes the wrinkles. So they're used differently. Restylane we usually use in the lower one-third of the face, and Botox we use in the upper one-third of the face mostly.
Interesting.
So this is the kind of consulting you can do with patients who come in who are curious about perhaps getting some work done?
Exactly. We can put them on the computer. We can say, look, this is what you might look like. It's no guarantee. You can't promise someone, but it's a great communication device where they can kind of tell us what they want. I can tell them what's possible, what the limitations. I can't make you look like Brad Pitt or Julia Roberts, but this is what we call Reese Witherspoon.
However,
Irene Ryan.